Welcome to the questions and responses for concussions part 1. Now let's get into it. Question 1 from Pensilitis. Pensilitis. What kind of problems could result from two closely sustained skull fractures and one with neck injury in a 12-year-old, and what the future outlook might be? The biggest problem, you're looking at developing bodies and developing brains. So when you have a problem with the structure, some kind of past trauma, you're altering the input into the brain. So this is huge. And skulls do not fuse. Skull plates move even in an adult, but in a kid, the mobility is huge. I mean, they literally are moving. So when you have past trauma, if it's not corrected, there's going to be loss of curve, some lateral deviation, and also in a neck trauma, look at the thoracic area, look at the lumbar, look at everything. So first off, you're going to look at sleep disturbances. And remember, we all have this automatic nervous system in two parts, sympathetic and parasympathetic, or the body could be responding to stress, which is the fight or flight system, or regeneration. Now, kids are in a massive regeneration because they're bigger spines and a nervous system. The bodies continue to grow until 18 to 25. So if you're altering that growth and that stimulus to the brain, you're going to alter how the brain forms as an adult. And look at the frontal lobe. Frontal lobe is impulse control. So you're looking at misdiagnosis of ADD, ADHD, attention deficit disorder, light sensitivity, sound sensitivity. And when you're in that stress state, you have decreased blood supply to the gut. So you're looking at poor nutrient absorption. And this is, in a developing body, it's horrible. Now, if you're using medications such as Tylenol, this is going to deplete glutathione and then further injure the brain because glutathione literally protects those neuronal structures. So you've got to look at the three stressors: physical, chemical, emotional. Look at bowel disorders, look at sleep disturbances, and eventually anxiety, stress, depression, impulse control, light sensitivity, sound sensitivity, poor nutrient absorption, everything. So you got to get them. Use our 7 questions to find a corrective chiropractor. All you need to do is have somebody take an x-ray, and I'm talking to the entire structure, do a series of adjustments, and then possibly take a second x-ray. Now, generally, I don't do post x-rays in teenagers or preteens because there's going to be, some sports injuries later on, and kids respond super, super quickly. So find somebody that's going to do a nerve scan. We do pre and post nerve scans on kids, generally not pre and post x-rays unless there's a significant structural deviation, and get the kid healthy. I mean, this is huge. But look at the physical, chemical, emotional stressors. Look at sleep patterns and look at bowel movement. So if there's a chronic state of fatigue, light sensitivity, sound sensitivity, difficulty in paying attention, and fidgety movement where they're always moving their leg, or they may have some intention tremors, because that's the body doing everything it can to generate dopamine and generate stimulus up to that brain, because that stimulus, that brain is hungry for oxygen, it's hungry for healthy nutrients, and it's in movement is like a nutrient to the brain. And look at symmetrical movement. So all these kids with head injuries, we literally sit them on a bench, put some weights on their legs, and have them swing. And the weights open up the knee joint, which is loaded with mechanoreceptors. And this gets information to the brain. But what you're going to see is the kids are going to have difficulty in moving their legs symmetrically. And they can regenerate. And the kids need to know that they can recover. And then, make sure that chiropractor is looking at the misalignments of the plates of the skull, because the facial bone could be misaligned. Look at how the kid smiles. They may have an asymmetry smile, or asymmetrical smile. So this means that there is going to be some kind of damage. Look at the pupils, pupillary dilation. There's tons of things that the chiropractor has to look at, but you have to heal the gut, change all the stress responses. So poor sleep, movement responses, and then the kid can recover. But you've got to identify the problem, correct it, because this is a physical distortion of the body and that alters that input into the brain. Now, please like this video, subscribe to my channel, and share this vital information. You literally can save lives and change the world. Now, question 2 from Lidus 111. How can we improve concussion-based sound and light issues? Okay, this is huge. When you're in it, again, look at your autonomic nervous system, 2 parts. Sympathetic means fight or flight, parasympathetic is rest and digest, and repair and regeneration. So when you're in a stress state, and this is exactly what a concussion does, your body needs more information. So imagine if you're being chased by a tiger. Your pupils are going to dilate because you need more information coming in. Your ears are going to be more sensitive so that you can be aware of the danger around you. So this is an absolute sympathetic dominant state or a stress response. I've had patients come in wearing headphones and dark glasses because they're in a chronic pupillary dilation where their eyes are open and their ears are super sensitive. And this is very, very common in chronic states of a sympathetic dominant state. So you have to look at the 3 stressors: physical, chemical, and emotional. So physical stressors, you've got to do an entire x-ray of the cervical, thoracic, lumbar, pelvis, everything, because any alteration in those structures is altering the input into the brain. Number 1, look at the physical stressors. Then look at the neurologic. If you can do an autonomic nervous system, heart rate variability, rolling thermoscan, surface electromyography, those are the tests that we do, but anything to measure that autonomic nervous system. Then you have to address the chemical stressors. So look at any medications the person's taken, look at the toxic food, toxic fats, and then get healthy fats, healthy nutrients, and look at sleep patterns. Sleep patterns are generally going to be interrupted, where the person is going to wake up tired, fatigued, they're not getting deep sleep. So look at how to change and reset that circadian rhythms so the person can get that regenerative sleep, because that's what happens during that sleep process. And then look at the emotional component. And there's ways to reprogram that emotional component, because we get addicted to chronic states of stress. And when you're in a chronic sympathetic dominant state, pupillary dilation, extra sensitivity to the sound, your body gets addicted to that and the brain gets addicted to that. We get addicted to those stress responses. So make sure that you're addressing the emotional component, the physical component, and the chemical component, and then you're going to see that light sensitivity and sound sensitivity decrease. From Glinda's Guidance. It's so hard to find outstanding chiropractic care, especially for post-concussion syndrome. Doing hyperbaric chambers, regular adjustments, but the symptoms persist. After the fall about a month ago, we continue to pray. Any thoughts on how best to heal the soft tissue injuries of the neck? Things we could do at home to help support healing. Yeah, number 1, when you're looking at the soft tissue, the muscles running down the posterior or the back half of the neck, they're not under conscious control. So if you have the head being knocked forward or laterally deviated, those muscles are going to be in a chronic state of spasm to pull it and to restore the curves. Now, this is hugely important because you do not want to address the muscle spasms. You want to address why they're spasming. So you need to get, the chiropractor has to do an x-ray of the thoracic area, lumbar, pelvis, and cervical spine. And I recommend static, where you're taking an x-ray, and stress x-rays, where you're bending that neck in to see what the structures, how much they can recover, and what the true damage is, and what the true potential for recovery is. And a lot of chiropractors don't utilize x-rays, which is nuts. You got to see what you're working on. So look at restoring the curve in the neck. That's going to be ideal. We recommend so many things. Like if it's a kid injury, they're going to watch TV with their chin in their palms, so you're getting that curve in. If you're sitting at a desk, you can put your elbows on the desk. Just let your shoulders relax so you're getting that curve back in the neck. Now, if you do any of these exercises and it causes pain, you've got to identify what the problem is. And this is the job of the chiropractor, to find out that if you can't go into full extension, then they've got to do adjustments in the thoracic, even in the lumbar, And then that's what we mean when we're talking about restoring the curve in the lumbar. We put, little tiny anything that's got a 4-inch diameter. Okay, anything. It's best if it's a plastic water bottle, or we use a foam piece or a rolled up towel, because by restoring the curve in the lumbar, you're going to affect the thoracic area, and that's going to affect the cervical area. So look at all the areas of the spine, because that's going to change the body going in. And when you mention prayer works in every study. So absolutely, you got to incorporate prayer. It's like you got one therapy, prayer, that works good in every case it's applied. So yeah, absolutely. And then look at the physical, chemical, and emotional stressors. So look at sleep patterns. Look at changing the structure. That's the physical stressors. Look at the emotional component. And then you'll see the brain and the body recover. But you've got to do an objective analysis. So even if you're just doing a nerve scan, okay, and this is going to measure the heart rate variability, maybe the rolling thermoscan to check and the spinal structures, but know that the position and motion of those vertebrae, it's like a battery to that brain. So if it's altered position and motion, you're getting altered signals up to the brain. So you've got to change that input into the brain so the brain can start to adapt, because you were looking at a chronic fight or flight state. Address the physical, chemical, and emotional stressors. Get that curve back in the neck, the curve back in the low back, correct any thoracic deviations, but you got to identify the problem first by utilizing an x-ray. I mean, that's like basic common sense stuff. And you can recover because the brain has the ability of called neuroplasticity, where it can start to regenerate new neurons based on the position of motion and the input from the body or the spinal structures into that brain. Question 4, advice for first responders from Trauma Chaplain. Just an idea for you to have a video on first responders. That would be a great idea. I have responded to crashes where they had a major blow, but they deny injury or a medical assessment. Absolutely, they do. Can you teach some non-contact ways to have a vehicle occupant check to see if they are concussive? Absolutely. We train on autism to stop bleeding, but crashes are more frequent for patrol officers. Thank you for this content. Subscriber for many years. God bless you. Okay, look at facial asymmetry. Okay, and this is really simple. Have them stare at you straight, okay, and look for pupillary dilation. Look for maybe asymmetry where one part of the eye isn't opening up as well. Look at a smile, and then frown. And if you see half of the face isn't working, or there's a significant asymmetry, everyone's going to have a little bit of asymmetry in facial structures, but if you see the motor movements are different, that's huge. And then look at eye movements. Okay, look at nystagmus. So if you follow my finger, go one side, go to the other side, go up, go down. And if you see a little nystagmus where there's a little bit of shaking of the eye, or that the eyeballs are not tracking as much, know that the upper cervical area, if there's been a trauma to that, then it can typically damage one of the cranial nerves responsible for the lateral rectus, or part of the eye movement. There's that in the oculomotor nerves. There's a bunch of eye muscles that are controlled by the upper cervical. So if you've had a trauma, you're going to see an alteration of that eye movement. So look at facial asymmetry, pupillary dilation, look at eye movement to make sure they can. And then, the orientation times 4, their name, an event or something that, how to spell world, just simple cognitive functions. They teach you that. Okay. But look at also how their movement. Okay. If they're walking away from the wreck or the trauma and one side is moving different than the other, balance issues are going to be huge. Breathing issues, swallowing issues are really huge, particularly in a whiplash trauma, because if you've had whiplash, you can have damage to the structures on the anterior front portion of the neck. Swallowing issues are a huge red flag, because that could be from the neurologic structures in the neck could be compromised, as well as the physical structures in the neck. Then look at asymmetry of the firing of the muscles. So if you have a head trauma again, just look and again, without touching the patient, you can see a massive spasm on one side and nothing on the other. That asymmetry of muscle firing, particularly in the muscles that run down either side of the spine, those are not under conscious control. So if you see an asymmetrical or one side's tighter than the other, that is a big red flag. And man, I really love your idea on how to respond to traumas. And we could do this on every type of injury, auto accidents, falls, sports injuries. That's a great idea for a video. My oldest boy makes a lot of the PowerPoints, and he is a genius on this. Yeah. We'll get to it, brother. From Harvest Ladder, after languishing for 2 solid years with what was being told post-concussion syndrome, I finally threw my juicer, blender, pots, and pans in the car and drove to Huntington Beach. It's my office. 2 adjustments later, I went for a walk on the beach, and all those symptoms were gone. His diagnosis was absolutely correct due to 100% loss of curvature in my cervical spine. I was receiving altered signatures to my cerebellum from my spine. I just needed to get some curve back. God bless you. And when you look at this, figure that cerebellum controls the frontal lobe. The frontal lobe is anxiety, stress, depression, impulse control, or attention deficit disorder. And you're looking at schizophrenia is there, bipolar disorder is there, and that gets its input from the cerebellum. And the cerebellum is one of the 3 structures that are involved in balance. You've got information coming up from the spine. That's the dorsal columns. You got the cerebellum, and then you got the vestibular ocular apparatus. Okay, now you need 2 of those 3 for balance and movement. So if you have alterations in the input of the cerebellum, you're talking 2 of them that are going to be malfunctioning. So just by restoring the normal position and motion of the vertebrae, and I'm talking just a little bit, bam, that changes the input of the cerebellum. But also, look at that brain, okay? It burns 90% of the body's oxygen, 30% of the body's calories. So, and it does it by creating its own food called cerebral spinal fluid. Now, that fluid's produced in the structure in the middle of the brain, and it flows down through the spinal cord, okay, to give nourishments to the spinal cord, okay? And that the spinal cord is a long tubular brain. So if you have alterations in the structure, then that cerebral spinal fluid can't flow down, particularly with what you're talking about, a loss of curve in the neck. And a way you could check this is the sutures of the skull, and the plates of the skull, particularly the sagittal suture coming down the middle. If you feel heat or tenderness on this, and you could press on the parietal bones on either side, it should not be any difference in tenderness. But if you feel a tenderness in the top of that, and this is why some people say, well, it hurts when I brush my hair, or my ponytail hurts, or something like that. But feel that tenderness, because that means that there's pressure inside the cranium. That's called intracranial pressure. That is not good. And the coverings of the brain called meninges literally invaginate up through those sutures. So if there is pressure in the skull, there is going to be tenderness and heat. And we'll see this a lot on kids and adults now diagnosed with autism, that there is brain swelling. Post-concussion, you're going to feel swelling or tenderness up there. So this is huge to identify intracranial pressure. And it's so simple once you get those curves back, that cerebral spinal fluid can drain. Literally, I'll check that on every patient to see if there is tenderness, particularly if there's a loss of curve, reverse curve, lateral deviation, something like that. And I'll tell them by the next day, that tenderness will be reduced, depending on the case, between 50 and 80%. And we will always see that inflammatory process or that tenderness reduced. And what does that mean? That means that the cerebral spinal fluid can flow and that there's less intracranial pressure. That huge, but God bless you. I'm so glad you made it to Huntington Beach. And it's keep up with the exercises, because we always give exercises for the lumbar curve, which is going to help the thoracic and cervical spine. Exercises for the cervical curve. We also teach deep pattern sleep changes, or to change that circadian rhythm, and also how to reprogram the emotional component. And every patient, we give cross-crawl exercises. So Actually, walking on the beach or walking on the grass is one of the therapies that we give, and we say get symmetrical movements, not where one side's moving more than the other, but where you're consciously getting symmetrical movements so you get symmetrical stimulus to the brain to heal the past brain traumas. God bless you, man. Keep healing. Now, if your question wasn't answered here, please go to the Dr. B VIP website. That's drbvip.com. And there we can speak freely. And God bless you all. Keep healing, my friends, because your body is designed to live on this planet. Actually, the planet was designed for you too.